What does an NHS specialist pharmacist actually do? My name is Yasser. I'm a specialist pharmacist working for the NHS in the UK. I currently specialise in interstitial lung disease. I'm going to go through a day in my life and show you what a day looks like, particularly when I'm working in the late clinic in the pharmacy. So I start my day at 8 a.m. on this particular day. Normally I would start at 9 a.m. At 8 a.m. I need to attend the interstitial lung disease multidisciplinary team meeting. That is the ILD MDT. This is an opportunity for us to look at complex cases of patients with interstitial lung disease. What we really want to see is if there's any disparity between the scans that they had previously. These are CT scans, and the scans that they've had recently. Has it shown progression of the disease? Has it shown improvement of the disease? Does this now warrant them to be on something called antifibrotics? Antifibrotics are medications that are used to slow down and try to prevent further scarring of the lungs. Pulmonary fibrosis, which occurs with patients with interstitial lung disease, is scarring of the lungs. So in order to prevent further scarring, you want to use something called antifibrotics. But there's very strict requirements of which patients can receive the medication, and therefore it's important within this ILD-MDT to look at who can appropriately receive the medication. Once these patients are identified, they'll be booked in with an appointment with myself to speak about the important aspects of the antifibrotics and how they should take them. Within the MDT, you have ILD nurses, ILD doctors, so consultants and registrars, and radiologists. Radiologists can look at the scans to identify if there's any progression with the disease, if the patient is getting better. So these are the kind of things that we will discuss in the morning meeting. Then I will go into my office and I will respond to my emails. This is the first day of my working week, and emails can tend to gather from the last few days. What these emails will normally be relating to is whether or not a patient has had new blood test results, and they've called to say that they've had new bloods. They'd like to discuss those blood test results with me. And on those occasions, I'd look at those new blood test results. I'll give the patient a call, discuss with them whether or not it's appropriate to restart their treatment, for example. So quite often, if I stop the treatment temporarily and then I ask the patient to have another blood test to see if there's any improvement with a particular value. Let's say they have an increase in one of their particular liver enzymes, which I'm a bit concerned of. I tell them to halt the treatment and take another set of bloods at a particular period of time. They give me a call to say those blood test results are ready, and I've taken them as requested, and can we discuss those results? And I'll give them a call, I'll look at the results, and I'll advise them on those results. Or I will look at prescribing medications for patients that have been on treatment long term. So if I've prescribed something for them 6 months ago and they are due for another prescription, then I may be prescribing medication at this stage. I will then look at a system where I identify any abnormal blood test results for patients. So we actually have a very clever system where we can identify the blood test results for patients, see if they're out of range, and to act accordingly with regards to these results. Now on this particular day, I'm trying to create a checklist for a particular antifibrotic treatment that we use. Now, the reason I want to create a checklist is I want to create a step-by-step guide of all the different aspects you have to consider when prescribing this particular antifibrotic. And that's to help people within the team to feel more confident when prescribing this medication. Quite often you'll have a range of different healthcare professionals within the team that need to prescribe treatment for a particular medication, and they may not feel as confident doing this than others, and that's why it's very important to provide a framework that all of us can agree on the bare minimum information and considerations you have to think of when prescribing this treatment. So this afternoon I'm working on a checklist for a medication called pirfenidone. If you remember earlier in this video I spoke about antifibrotics. Pirfenidone is an example of an antifibrotic. Once I've completed this, I send this to my manager to take a look at to see if she agrees with all the parameters that I'm looking at with regards to the pirfenidone treatment. This takes me up until about 5 p.m. and at 5 p.m. I head over to the pharmacy. We work on a late clinic and that's really to assist with discharging patients out of hours. So if all the pharmacists have gone home at 5:30, and you've got patients that still need to go home, or they still need medication to be prescribed for their particular conditions, then at that particular stage, we'll dispense that medication to the wards or arrange for the discharge medication so that patient can go home with that medication. That will normally end at 7 p.m. Sometimes it can be later at 8 p.m. This is what would be considered a long day for me, but it gives you a good insight into the NHS hospital pharmacist roles. Of course, specialist roles can differ vastly from one speciality to another. Hopefully you found this video useful. If you did, like this video, check out my other videos and subscribe.